Welcome to the Community Outreach Lab Introduction to Stretching through the Department of Health and Human Physiology at the University of Iowa.
If you choose not to stretch after physical activity, there is increased risk of injury, muscle tightness, and joint pain. You should adjust stretching techniques according to personal medical conditions, injuries, and/or a physician's recommendation. Stretching positively impacts our physical health as well. According to numerous reputable sources, regular stretching increases our flexibility, range of motion, and physical performance, which in the long run will reduce our injury risk or the severity of it. Practicing stretching also increases blood flow to our muscles, greatly influences the state of our mental health, and helps to induce a relaxed physical state.
Before getting started with stretches, we'd like to go over some general safety tips. First, and most importantly, never stretch as a warm-up to physical activity. Our muscles need to be warmed up via exercise, perhaps dynamically, prior to performing stretches. When stretching, a goal to keep in mind would be achieving flexibility symmetrically on each side of the body, which will also help prevent injury. It's also very beneficial to stretch the parts of your body that you use regularly, as this will aid in performance of your everyday bodily movements. Never bounce while stretching, as this may result in muscle tightness and an increased risk for injury. It's important to note that tension does not equate pain. However, listen to your body and know its limitations. Lastly, always exercise caution. Adjust stretching techniques according to any medical condition, injury, and/or a physician's recommendation. Following the American College of Sports Medicine guidelines, upper and lower body stretches should be performed 2 to 3 times a week after performing physical activity. You should always stretch until you feel muscle tension or slight discomfort. Adults aged 18 through 64 should hold static stretches for 10 to 30 seconds, and older adults aged 65 should hold stretches for 30 to 60 seconds, which will help with flexibility. We will break down several stretches into an upper and lower body floor routine, beginning with upper body stretches. Our first stretch is head circles, and you will primarily feel this in your neck. Keeping your back straight and your shoulders back, start by tucking your chin into your chest and begin to slowly rotate your head counterclockwise. Complete 10 rotations, and then repeat in the clockwise direction 10 more times. This stretch is called the Trapezius Stretch. You will feel it in your neck. Keeping your back straight and your shoulders back, slowly tilt your head to the right side, almost as if you were trying to touch your ear to your shoulder. Then, use your left hand to gently pull your head closer to your shoulder for a deeper stretch. Hold for 30 seconds, rest, and repeat on the left side for another 30 seconds. This stretch is called arm pulls, and you'll feel it in your shoulders. First, sitting up on the floor with your legs parallel to the floor and keeping your back straight, reach your right arm across your chest. With your left arm, you will push your right elbow closer to your chest. Hold this for 30 seconds. Rest, and then repeat with the left arm. The next stretch is arm scissors, and you'll feel this one in your shoulders and upper arms. Continue sitting on the floor with your back straight and shoulders back. Reach your arms out straight in front of your body. While keeping your arms parallel to the floor, you will cross over your arms by moving them in opposite direction of each other. Ensure that your arms are still parallel to the floor during this movement. You will alternate the top and bottom arm on each crossover. Complete 20 crossovers. Next, we have Russian twist. You will feel this one in your lower back. Lie your back flat on the floor with your legs together and arms straight out to the sides, forming a T shape. Bend at your hips, moving your legs towards the ceiling while keeping your legs together. Bend your knees to a 90-degree angle and slowly rotate your legs to the right side of the floor while maintaining the 90-degree angle. Hold the stretch for 30 seconds. Rest. Repeat with the left side for 30 more seconds. Our last upper body stretch is the Cobra Stretch, and you'll feel this one in your hips. While remaining on the floor, turn over to lay on your stomach. Bring your legs together with the tops of your feet pressed into the floor and your head facing forward. Your arms will be at your side, resembling arm position during a push-up. With your shoulders back, push your torso off the floor with your arms, keeping your elbows close to your body and your lower body touching the floor. Hold for 30 seconds. Now, we will continue on to lower body stretches. This routine will be completed on the floor as well. The next stretch is the butterfly stretch and will be felt in your hips and inner thighs. Begin with your torso perpendicular to the floor, shoulders and neck relaxed with your knees hugging your chest. Then, let your legs fall to their respective sides on the floor. Bring the soles of your feet together, put your hands on your feet for support, and bend at your hip towards the floor, keeping your head facing forward. For a deeper stretch, move your feet closer to your body. Hold the stretch for 30 seconds. This is called the hamstring stretch, and you'll feel it in your hamstrings. Begin with your torso perpendicular to the floor and shoulders and neck relaxed. Stick your right leg straight out. Bend your left leg at the knee, bringing the sole of your left foot against your right inner thigh. Extend your arms and reach for your toes while lowering your chest and keeping your head facing forward. Hold this stretch for 30 seconds. Rest. Repeat on the left leg for 30 more seconds. This stretch is called sitting toe touches, and it will be felt in your legs. While sitting up on the floor with your torso perpendicular and legs parallel to the floor, reach forward and try to touch your toes, moving your chest towards your legs and keeping your head facing forward. Point your toes for an added stretch and hold this position for 30 seconds. Next, we have the supine leg stretch, and this will be felt in your legs. Lay your back parallel to the floor with your shoulders and neck relaxed, resting your head on the floor. Pull your right leg towards your body while keeping the right knee bent. Interlock your fingers together on your knee to hug your leg. Hold this for 30 seconds. Rest. Repeat on the left side for 30 more seconds. The final stretch is called the ankle stretch, and you'll feel this in your foot. Sit up on the floor with your shoulders and neck relaxed, your legs parallel to the floor, and slowly rotate your right ankle in the clockwise direction 10 times. Then, rotate your right ankle again 10 more times in the counterclockwise direction. Rest, and repeat clockwise and counterclockwise rotations 10 times each on the left ankle.
Stretching is a key determinant of your health status later in life. Whether it be mobility or heart health, stretching can significantly improve your quality of life.
We hope that this has been useful in jumpstarting the stretching aspect of your fitness journey.